Behcet's disease is a rare autoinflammatory condition that affects primarily the small blood vessels. Wherever blood flows, Behcet's goes. Hi, my name is Sammy, and despite being a nerd fighter since 2013, this is my first year making a Project for Awesome video. That is because this year has been like no other for me, because this is the year that I was diagnosed with Behcet's disease. And it's kind of changed my life. The diagnosis process, the treatment, and the ongoing misunderstandings within the medical community about this disease have been the most difficult challenge that I've ever faced. And that's despite the fact that this year probably looks like the least productive that I've ever been. That is why this Project for Awesome, I am urging you to please vote for the American Behcet's Disease Association so that more people and doctors will better understand this life-changing and really terrible disease. Despite the fact that I was actually misdiagnosed and I received a lot of mental health treatment from doctors who believed that this was all in my head, I was actually really lucky to be diagnosed within a couple years of first showing symptoms. And a lot of people with Behcet's are really not so lucky, and that is not just a tragedy because of the stigma that they face and the fact that people don't believe their illness and they don't get the accommodations that they need, but it can even lead to death. Those that fail to be recognized, like Allison Hunter, prove why awareness matters. Allison died of likely Behcet's disease at the age of 19. She really could have easily been diagnosed by someone who was trained, like a rheumatologist, but instead her symptoms were dismissed as chronic fatigue syndrome, and she didn't receive any treatment at all until days before she eventually died. This really shouldn't happen. Doctors should be trained to look for ulcers, which is a key sign of Behcet's, in chronically ill patients, and screenings for autoinflammatory conditions should be routine. Behcet's disease causes inflammation of the blood vessels, which means that it can affect any organ, but the primary diagnostic markers of Behcet's disease are ulcers, which leads a lot of doctors to believe that Behcet's is just a skin condition. But in reality, the most dangerous parts of Behcet's disease are the neuro and ophthalmological parts, and the drugs used to treat these symptoms are no joke. They include powerful steroids, immunosuppressants, and even chemotherapy drugs. In Japan, 80% of male patients developed ocular involvement, and that led to blindness in up to 25% of patients. And in the US, up to 30% of patients suffer from neurological involvement. There is no test for Behcet's disease, and it's identified purely through clinical criteria. Because it's so difficult to diagnose, that leads to many Behcet's patients being misdiagnosed repeatedly. Behcet's can cause a lot of symptoms that are associated with many other disease. So, for example, neuro-Behcet's a lot of times mimics MS, so patients will get an MS workup. Gastrointestinal symptoms are actually incredibly similar to Crohn's disease, and so they'll get a Crohn's diagnosis. And 80% of Behcet's patients also hold a fibromyalgia diagnosis because we all suffer from chronic pain and fatigue. The ABDA is working to increase doctors' awareness of the many complications of this disease and research more effective treatments to help improve patient outcomes. Another practice that the ABDA is working on is working to advocate against the use of step therapy. And step therapy, or fail first, practices and prescriptions basically work like this. So currently, to access a lot of treatments, particularly expensive treatments like immunosuppressants, Behcet's patients must first try and fail to tolerate cheaper medications before they're given access to the more expensive ones. So imagine if you had cut your leg down to the bone and the paramedics arrived and said, "You need stitches." Then your insurance person steps in and is like, "Okay, well, before we try stitches, let's just give you like a little Band-Aid." "Oh, okay, I saw you bled through that. Okay, let's try some gauze now." "Okay, yeah, you bled through that. Okay, maybe we'll try tourniquet. Oh, I guess I see you're in danger of losing your leg now. Okay, now you can have stitches." And this system is completely inappropriate to enforce if the medical doctors on site said, "You need stitches." And that's why the ABDA is really needed to advocate for us. This is what Behcet's disease is to the medical community, at least those who know of it. But for those of us who suffer, it's a lot more. For me, Behcet's disease is spending the week bedbound with a flare because I dared to go to a family holiday. Behcet's disease is doctors telling me that my symptoms are too disparate to be caused by one illness. Behcet's disease is spelling out Behcet's, B-E-H-C-E-T-S, to every single paramedic and ER doctor. Behcet's disease is being checked for STDs again and again for ulcers that only needed a simple steroid. Behcet's disease is fighting for off-label medications and treatments because the studies to prove that they work don't exist. Behcet's disease is losing your livelihood, your hobbies, and your friendships to pain and fatigue. And here is one of my friends from a Behcet's patient group to talk about how it affects her.
Behcet's is a systemic disease, which means it affects multiple areas of the body. For me, that means it affects my vascular, nervous and digestive system, my eyes, my skin and mucous membranes. I experience the symptoms in flare-ups, which means that sometimes the disease is more active than others. Which means in turn that on some days I am able to do things that on other days I am not. Because it happens all over my body, new symptoms crop up all the time, and this means that explaining it to other people is really hard. I often feel like people think, oh, there's another symptom again. The best thing about Behcet's are the amount of people that I have met worldwide who also have the disease. I class these people as my friends that guess what it's like to live with such an odd and unpredictable.
The American Behcet's Disease Association's goal is to support, educate, and empower the Behcet's community while advocating for better research, diagnostics, treatments, and eventually a cure. I urge you to support patients like me by voting for this video on the Project for Awesome website linked below, or by donating at
www.behcets.com/makeanimpact/donate.
Don't forget to be awesome.